Let's move away from the politics of the pandemic and focus on what the medical experts have to say. We're joined by Dr. Bharat Pankhania. He's a senior clinical lecturer at the University of Exeter. Good morning to you. The talk now is of whether national lockdown versus local lockdown and the benefits of either. What's the criteria that will actually tip us over into going for that last resort, as the Prime Minister says, and going for national lockdown?
I hope it will never happen because I don't think the United Kingdom has got the stamina for a national lockdown. It's words. I hesitate in answering this by saying it is blindingly obvious that if you want to keep case numbers down, you keep your movements amongst fellow human beings to a minimum. It's as simple as that. This is a human-to-human spread of infection. So we've invented all manner of things like the rule of 6, the curfew at 10 p.m. and all of that. And the one thing, the elephant in the room that we don't address is keep your distance away from fellow human beings. Move around with as few a number of human beings as is possible. That is as straightforward as it is.
In a sort of epidemiological sense, this talk of a circuit break, which is at least a possibility here, where there may be, sort of full lockdowns for certain areas for, say, a couple of weeks. In terms of breaking the cycle of the spread of the virus, would that actually work?
I would love to say yes, but what we learned from the first lockdown was that the base number, meaning the background level of circulating virus, continued to hover at an uncomfortably high level. So where is the evidence that a circuit breaker, meaning a short, sharp shutdown, is going to reduce case numbers? Our case numbers have resisted in going down because we just cannot have a full lockdown in the way the United Kingdom has been running. So unless you have a really, really strict South Korea style or even China style shutdown and people don't move around between groups, it's not going to happen. Furthermore, we've got another conundrum, which is schools are open and we all accept that the schools need to run. So if schools are open, it means a lot of things are open. It also means there will be generation of new cases in the school environment.
So would you advocate a short, sharp shock, if you like, so everything locks down for a period of, say, 3 weeks to a month? Might that be a way to stave the spike?
No, I don't think so. I've thought about this for so long and reflected, and I think my most simple measure over a long period of time is one good measure, which is you advise people that this is a human-to-human spread of infection, so you keep your circulation low amongst fellow human beings. It's as simple as that. We keep on inventing all manner of rules and outcomes that we may want to try. Why not just give the good public health advice, which is this is human-to-human spread, keep your circulation low amongst fellow human beings?
I mean, so the bottom line there seems to be the government can say, and indeed, to an extent, the medical experts can, along with the government, say whatever they like. It's down to us to take personal responsibility then.
You are so right, and I have been saying this for months because it is personal responsibility and it is our mutual responsibility. And furthermore, if I may add, just because young people get the infection and get better doesn't mean all is well, because they could do two things. One, they could end up with long COVID syndrome, which is a prolonged illness after they recover from their infection. And second, they bring it to their elderly or more vulnerable people and they get more severe illness. Therefore, absolutely right. The bottom line is we take personal and mutual responsibility. We say to ourselves, every action that I'm about to take, is this risky? If it is, don't do it. So, for example, as the case numbers are now going up, my advice to Prime Minister Johnson would be, don't sit there and say, we're going to do something next week. It's tomorrow, it's today. You say, as of today, please reduce your circulation in pubs, restaurants, transport, offices, and all those places where infection transmits. It's as straightforward as that.
But can we rely on people to take personal responsibility? That is the question. Dr. Bharat Pankhania, thank you very much for sharing your expertise with us this morning.
Thank you.